Growth hormone, another one that declines as we age. So, growth hormone is released via our pituitary gland. So, that's in our brain. We release growth hormone at night, like as we sleep. We release a little bit of growth hormone. So, what a growth hormone secretagogue does, taken as a peptide, it stimulates your natural growth hormone release. It is not growth hormone itself. So I know some people, they ask me all the time about growth hormone. So growth hormone itself is an exogenous growth hormone, exogenous substance, right, that you take, and it just increases. It depends on dose dependence, right? With a growth hormone secretagogue, it's just stimulating your pituitary to release your own growth hormone, more so than you do currently. So it will only increase that amount as much as your pituitary gland will release. It won't go out of control. So there's kind of a stop. It's a natural pulsation. So it's pulse dosing. And I'll tell you about the different growth hormone secretagogues I'll be speaking to. Some of them are longer acting, longer pulsations, meaning the pituitary is pumping out longer pulses of growth hormone versus other ones that are kind of shorter bursts of pulsations. And so it stimulates your natural growth hormone and it preserves your pulsatile GH secretion. So your natural will still work, meaning it's not overriding your natural production, where taking an exogenous growth hormone could do that. Okay? The growth hormone secretagogues do not replace your natural growth hormone. Like your natural will continue. Okay? And some of the benefits. So why would we take this, right? Like why would we use growth hormone secretagogue? And the reason is it helps to increase our growth hormone, which helps to improve our lean muscle mass, and it improves body composition by decreasing visceral fat. So it decreases our body fat percentage and increases our actual muscle, right? Lean muscle mass. And it helps with me recovery. So it helps to recover. So when we sleep, when we release growth hormone as we sleep naturally, it helps our muscles and our tissues, ligaments to recover. So it also helps with that. It helps with sleep quality. Huge. When I have someone who tells me they can't sleep and they're optimized already on hormones like progesterone, right, which helps us sleep, I will recommend a growth hormone secretagogue. And like 9 out of 10 times, they will sleep like a baby and say, I have never slept so good in my life. So they help with sleep quality, deep sleep quality, REM sleep, and stage 3 sleep, which is deep sleep. It also helps to improve your skin, hair, and connective tissue. So again, hair growth, right? How many of us experience thinning of our hair as we're aging? Kind of our skin feeling a little dull or not as elastic. Growth hormone helps with that too. Okay.
How do you dose this?
Right. So growth hormone, it depends. So every growth hormone is, and I'll tell you about the various growth hormone secretagogues we use. So there are many different growth hormone secretagogues. And, you know, for years, originally there was one called Sermorelin. That was one of the first generations. And now they've progressed. So a growth hormone, remember, a peptide chain, it's amino acid chains. It's like a fragment of a protein, right? So over time, they've improved, right? As they're synthesizing these growth hormones, they've gotten better. It's like people will ask me for a first generation growth hormone secretagogue. It's like wanting to go back to an iPhone 1 when we have iPhone 20 now, right? Like they've improved over the years. So, same with really anything, growth hormones have improved. So, in my practice, I love CJC 1295. That's one of them. And I'll talk a little bit about that. It's a growth hormone secretagogue. It increases growth hormone release. It increases IGF-1, tissue repair, recovery, lean muscle preservation, again, sleep quality, bone and connective tissue. And we pair the CJC 1295 often with something called ipamorelin. So ipamorelin is a ghrelin receptor agonist. So it acts on a different pathway, but they work together synergistically. And they're usually, when we order them, we prescribe them, they're already together. So they're together in one vial. Okay, so they work very well together. We love those two together, and they work synergistically. So really, with the tissue repair, muscle repair, and they have, with the lean muscle preservation, that's the big one. So for women of midlife, we love growth hormone secretagogues because it's so difficult with that decrease in muscle mass, the sarcopenia that occurs post menopause. So growth hormone secretagogues are fantastic. Love that for that. Now, the newest one, the latest and greatest growth hormone secretagogue, is called tesmorelin. That one is actually FDA approved for a specific reason, and that is for HIV patients that have lipodystrophy, basically abdominal fat. That's what it's approved for, to decrease abdominal fat in HIV patients that have this lipodystrophy. So, we use it off label. It is a growth hormone secretagogue. And the big thing about tesmorelin is that it really cuts down on the visceral fat and abdominal fat. So that's why that's our favorite. Women in midlife. I mean, this is the big problem. So many women come to me and say, I still eat the same way. I work out the same way. And I just have this pouch I cannot get rid of. And really, tesmorelin's great for them after hormone replacement therapy is optimized. So here's the thing about growth hormones. We make sure to go through people's past medical history prior to prescribing. So think about it. Growth hormone secretagogue is going to cause the brain to release more growth hormone, right? And growth hormone helps things grow. So it helps muscles grow. It increases growth of your organs, everything. If you had a malignancy, perhaps, if you were someone who had a history of a malignancy or currently were diagnosed with a malignancy, then we would not prescribe something like tesmorelin, or actually most of them, because most of them do help to increase your growth hormone, even BPC 157 or NAD. They help with angiogenesis too, so they improve blood flow. If you had a malignancy and you're improving more blood flow and adding increased growth hormone, that wouldn't be something that we would want to do. But for the majority of people, not really. There's not a negative downside. Some side effects that could happen. Some people will experience carpal tunnel. So like a carpal tunnel, wrist, kind of joint wrist pain. Some swelling. Some people will get like a numbness and tingling in their fingers. You might retain a little bit of fluid for a short period of time. But for the most part, we're using them for such a short period of time that it doesn't increase your risk overall for these things. So listen, full transparency, peptides, there aren't enough studies to know the long-term effects of them. We tell everyone they're not FDA approved. There are not many long-term studies on most of them. So there's long-term safety profile I can't really speak to. That being said, in the short term and short period, as long as you're being monitored, we do frequent blood work too. So we do blood work in the beginning. We do it 4 months in. And we're kind of looking at specific markers to make sure certain markers are like decreasing and certain markers are not increasing. I hope that answered.